Hello, everyone. It's my pleasure to speak to you this evening. I'm very honored to be one of the good speakers in this conference. We enjoyed all the informative talks. So I'm going to talk to you today about the impact of COVID-19 on BME in the UK. But actually, if you look at other world's data, for example, the US, you'll find it very, very much similar. So I think the scenario which I'm going to talk about can be applied in most of the countries of the world. So emerged in December 2019 in Wuhan, China, COVID-19, the disease caused by the highly pathogenic coronavirus SARS-CoV-2, of course, quickly spread around the world, causing devastating impacts on health system and on economy, as well as thousands of deaths. Total confirmed cases up to the date I prepared this presentation were 14 million cases with 8 million recovered, but sadly 603,000 deaths. However, COVID-19 did not treat everyone equally. COVID-19 discriminates against age, sex, and ethnicity. In this presentation, I'm not going to talk about age and sex. We're talking about the ethnicity and how COVID-19 impact ethnic groups, minority. And for most of the data I'm going to talk about, we actually adjusted for age. Yeah, so it does not actually take the inter. So when we talk about ethnic groups, when I say white, I actually mean white, British, Irish traveler, other white. When I say mixed or multiple ethnic groups, I mean white and black Caribbean, white and Asian, white and black African, and other mixed groups. Indian, Bangladeshi and Pakistani, Chinese, black is black Caribbean, black African, black other. Other ethnic groups is Asian, other, Arab, and other ethnic group. So it became now, after all the research and data available, it became evident that COVID-19 is disproportionate impact, has the disproportionate impact on black, Asian, minority ethnic people, which for short, we call them PAME or PAME. Those impacts varies from impact of the social distancing measures. Of course, this caused loss of income, caused effect on mental health, and all the impacts of being isolated. We have socioeconomic impacts. We have impact on health and social care workers from BAME backgrounds, and we will come to know later in this presentation that actually BAME people are overrepresented in social care work. Also, the effectiveness of communication about COVID-19 with and within the BAME communities. Considering BAME or ethnic minorities only contribute to 13% of the population of England and Wales, BAME people admitted to the intensive care because of COVID-19 were 34% of total admission, and this is a very big percentage relevant to their percentage of population. Right. Okay. So analysis showed very clear evidence that deaths because of COVID-19 and COVID-19 related conditions in BAME is significantly higher than white population. It has been found that BME has between 10 to 50% higher risk of death when compared to white British. This death and risk of encountering COVID-19 cannot be explained by one reason or one factors. Actually, it's a mixture of complex factors that intertwine with each other. And when I'm going to talk about them in this presentation, I'm putting them in orders, but actually they cannot be put in order, if you understand what I mean. It cannot. It's all like in a perfect circle. They all feed each other. After adjusting for age, we'll find Black ethnic are actually 4 times more likely to die from COVID-19. To be precise, Black males 4.2 times and Black females are 4.3 times, Asian males 3 times, Asian females 2.4 times more likely to die than white males and females. The more shocking fact is 50% of pregnant women hospitalized with COVID-19 were actually from BAME. In particular, Black pregnant women are 8 times more likely to be admitted to hospitals than white pregnant women. And this is very, very sad and shocking results. If we look at the population over in the UK, of course, we'll find the white population, it's at 86%, second Asian British at 7.5, Black are 3.3, mixed at 2.2, and then all other ethnic groups come to 1%. This is very important. If you look at this chart, bear it in mind and have a look at the ethnicity of confirmed cases and ethnicity of deaths, and you will quickly come to conclusion that BMA contributed to the more deaths and cases than deaths and confirmed cases than white population, relevant to their percentage of population. If we look at it in like more number or more clear numbers, comparing the NHS data to the Office of National Statistic data, we'll find those numbers very, very similar. Actually, Office of National Statistic, they take in consideration data from England, Scotland, and Wales. They take data from deaths inside hospital, outside hospital, confirmed cases and suspected cases, while NHS only count for England and death in hospital. But it's very, very similar. There is no much difference. And actually, we will find that BME people are 20% higher to die in hospital than white population. If we look at the higher risk of death in just bar, to make it very, very clear, that we can see Black are on the top of the risk of dying from COVID-19, followed by Bangladeshi, Pakistani, when white British are at the bottom of the chart. The normal risks for COVID-19, when I say normal, like, you know, what people talk about is age, being a man, heart disease, dementia or having a stroke, diabetes, being overweight or obese, high blood pressure, work, geographical area, because we know there's areas in the UK that's been hit harder with COVID-19 than other areas, and living conditions. Smoking is a factor, but ethnic background is actually a big factor if you consider the numbers we talked about. Sorry, that's a plane. If we talked we talked about in previous slides, and ethnic minorities actually are more prone to heart disease, diabetes, obesity, high blood pressure, their work nature, and the low income from work, and also geographical area, because they are overcrowded in areas and worse living condition. And I will talk about this in more details. So research in the UK showed that for sure ethnicity and income inequality are independently associated with COVID-19 mortality. We have housing issues. And with housing, we'll find actually 1 in 3 homeless households are from BME. Homelessness among BME rose in the past 5 years by 48% compared to only 9% among white. And of course, homelessness becomes because of the lack of social housing. We don't build enough social housing. BME are less likely to afford buying their houses or even paying rent. So that leads to homelessness. And of course, we all know now homeless are at risk of encountering COVID-19 more. Overcrowding as well, and BME are more likely to be overcrowded, and we found actually they are 4 times more likely to be overcrowded than white population, whom like the majority have 2 bedrooms more than what they need. Of course, when we are overcrowded, then this leads to increase of virus transmission risk and failure of self-isolation. Then another factor is the geographical area, and we know, for example, London has been hit hard with COVID-19, and it's usually the crowded urban areas were affected by COVID-19, and this is where BM actually tend to live. The nature of work is another factor, and jobs that require frequent contacts are at risk more than other jobs, such as healthcare, taxi drivers, shop workers, construction, and so on. We find, for example, Black African of working age is 50% more likely to be a key worker. And key worker, when we say key worker, we mean social care, health care, education, public services, food, and so on. So that means they are more likely to encounter or become infected from COVID-19 because they have contact with others, and it's very difficult for them to lock down or self-isolate. Then we come to another factor, which is the income. And actually we have a high unemployment rate among BME people. A big percentage of them is self-employed people. So that means during the lockdown, they lost their income, or it's been decreased to a really high percentage. They are most likely to be on 0-hour contract. On BME families, we find actually most of them depends on males or men to be the sole provider, and adding that to the factor being a man is put the risk of encountering COVID-19 higher. Also, they are more likely to work in shutdown sectors. We have a very important factor as well, which is racism and bad experience of experiencing racism. We have racism among or against health worker, and that actually stopped them from seeking or asking for PEE. And I'm sure Dr. Seher will talk about that. So I did not put more details about health sector. Also, bad experience of encountering racism will make it more difficult for BME communities to seek medical assistance or to seek help. Another very, very, very important issue, and I think the previous session we're talking about private education, and private education will just add salt to the wound, will make it even more difficult. And when I heard about it, actually my heart sank, because education is a big factor on affecting BME people. So we have in England educational attainment at GCSE and degree level is low for most of BME. The lower education attainment or poor English skills will affect how we communicate the health information, or how they can seek medical assistance, or how they can communicate with their doctor or with their teacher, how to communicate the information with the PME or within the PME. Also, that would affect the rate or the chances of getting employed in a good job. We found actually, and we were very, very surprised, that children from poorer or ethnic minority backgrounds are often predicted worse grades than they end up achieving. And this, well, you could say, well, at least they will achieve higher grades, but this affects children in school and their attitude to study, and their attitude to university, and their attitude to their other peers and friends. If a child is working really, really hard, but their teacher will just predict the worst grade just because of their background. It's not like, you know, it has a very, very great impact on children. Also, the lack of free school meals for those on low incomes would affect their health, and also, like, you know, how they resist disease and their mental health and, you know, welfare and so on. So we need to move forward. We cannot just, like, you know, keep talking about, we have to suggest solutions. So one of those solutions is actually research. We need to conduct more solid, informative, more in detailed research that would actually provide us with evidence from other epidemics, because now we come to know BME are affected with health emergencies and other epidemics, not just COVID-19. The impact to be included in those research, we have to know about infection risk, severity of the infection and outcomes, the impact of the infection and the control measures in place on BME individual communities. We need also to put a very strong structured training to remove unconscious bias when it comes to education. So teachers have to be trained to look to the individual, not to their background or to their color. They have to look at their achievement and potential. We also need to train healthcare system employers to actually employ more of the PME and treat them equally, on housing sectors as well, on providing mortgaging, allocating social housing. We need also to place heavy monitoring to allow for equal opportunities. It just cannot be left for people to do it themselves. We need to build more social housing so we can avoid homelessness, we can relieve overcrowding. We also have a big problem with local housing allowance freeze and housing benefit freeze. So we need to end this freeze and allow for more housing benefits and housing allowance, so BME people can actually afford to rent houses or to move to a better accommodation. We need also, when we build social housing or allocate social housing, we need to think about integrated neighborhoods rather than segregated communities, which is happening right now. Education in the UK for school, it's mostly funded by tax from the area where the school is. But as I said, we have segregated communities. So we have areas that's heavily with a BME. So that low employment rate means low tax, means low funding for schools, so low education attainment. So it's all, as I said, it's all intertwined with each other. That's me. Thank you very much.
Thank you very much, Dr. Shadia.
I did not pass the time. Thank you.
No. You're one of the few people who they have managed to do their presentation on time, which is normally the things we always appreciate. Thank you very, very much. Very wonderful. Just one question before I open this for the question, because I asked this to a couple of people when we had that Black Lives Matter, we had Farida. And did you find any, or two questions, did you find any evidence of any genetic makeup of the Black people will make them more susceptible to this disease, or is it all about the factor? Because the factor, you said they are all relating to the ethnicity.
Yeah, well, actually, all the studies they say, well, they adjusted for age and for sex. Genetic, they have not looked at it. But one of the papers I read, they said, well, actually, genetic don't play a role in this, apart from the other health factors. So, say, for example, people from Black ethnicity are more prone to have diabetes, yes, or cardiovascular disease because of the obesity as well. This could be related to genetics, but you know, all the other factors are very, very important, as well as the medical conditions. And actually they all feed into this medical condition, because when BME or Black ethnicity or ethnic group suffer from this medical, we have the education, we have the language barrier, which means you cannot even teach them about their disease, you cannot teach them about how to prevent those diseases, they cannot communicate, they cannot get the treatment right. And also if they are in low employment rate or in unemployed, or they don't have educated income, that means their lifestyle is affected. So that means they're eating unhealthy food, so they are becoming obese and they are having all of the disease. So if we want to move forward, we need to improve the living condition of BME before we can talk about even medical conditions.
Excellent. And have you come across any evidence from any other European OCDs, European in particular, any European countries with similar studies or any exploratory research about Black and ethnic or minority ethnic in, say, in Germany, in France? Did you come across any of?
To be honest, I couldn't find any studies in Europe, but I found studies in the US.
The US, they have been, okay.
Yes, they are studying this, and we actually have very, very similar results and outcomes.
Okay, that's very good. One I have here, when we open this when we show the program, which is being going for discussion about policy, if the government is doing anything, Dr. Shadia, about this now?
No, they're doing nothing. And
a very short answer.
A very short answer, and very, very angry answer as well, because most of the data I've got in my presentation, I got them from reviews that's being conducted by the Prime Minister office. So if you think he, like if I say, well, he knows that, for example, Black children are more likely to get the worst predicted grades. He informed about that. An education minister was informed about that, but there is nothing has been done. They know actually we struggle with accommodation, and he has all the data, he has all the numbers, everything, but yet he put the freeze on housing benefits and local housing allowance and stopped building new social housing. So they are informed, they know what's going on, but it's really sad there's nothing done.
Thank you very much, Dr. Shadia. And I have a question in the chat for both you and Dr. Shadia. It says, I can read it. I don't know if you can see, but I can read it. My question to Dr. Shadia and Dr. Olivia Joseph, we have followed through the media the news that the British government is supporting the private sector for 55 million. And this support may include the entire population without screening the population or the groups affected by the corona pandemic, which means the employment, whether of color or white, so you mean Black or white or ethnic minority, has benefited from the support. Any confirmation of this news? But I think the question is really not any confirmation, but if you know about this, does that take you back to the point, Dr. Shadia, about the government is not doing anything? They're just throwing money, because if you have a certain group of the economy of the population is affected more than the other, you should clearly be supporting them, like the presentation we have seen earlier about discrimination and equality and so on. Yes, so yeah, you got to start, Shadia.
Yeah, so basically, the first suggestion for this help to the population, they suggested giving money for housing improvement. So every landlord or landlady will get, I think, about 5,000. I think, I'm not quite sure about the number, but I think it's 5,000, like grant to improve their house. And then 500 is voucher to every single adult in the United Kingdom, and 250 for children to go and do shopping. Then they changed that. So instead of giving the 500 or 250, which everyone celebrated this news, they thought this is to be true, and they were thinking about buying clothes or paying for essential or whatever they need. So they changed it. Instead of giving every single adult this money or children, now they're giving them 50% voucher to eat out. Now, if you remember from my presentation, BME or people of ethnic minority are already unemployed. They have unemployment higher rate. So if you are going to give the private sector, the companies, the business, to keep their employees in their jobs, we are not in those jobs. We don't have jobs anyway. We lost our jobs. For self-employed, there is a scheme to support self-employed, but again, we have the language barrier, we have the lack of information. So most of the BMA, they're not familiar with this scheme, and they don't even know how to apply for it. For landlord, these grants to improve their houses is even going to, I think, widen the gap, because BME, 70% of white population own their own houses. When BME, I think this comes to 7% only. So we are in private rent. So how are we going to benefit from this? So to be honest, to my opinion, like, after analyzing what I said now, all the facts, even the British government help is planned and designed for the higher population, the white population, not putting in mind BMA population.
Okay. In addition to being a scientist and a virologist, and you're a distinguished scientist, you deal with the science. You have the advantage, you are someone in the public domain, you are a campaigner in different fronts, not just Black Lives Matter, but you are a political commentator. And as I think you recently become the Labour Party BAME representative or leader. If I can ask you just to finish this conversation with one or two maybe policy recommendation for the government. You said the government unfortunately has done nothing. You said that was an angry answer. So give them not an angry proposal, but a practical thing they can do, because Olivia already agreed to anything you mentioned about the way the government is not taking its role. Give us one or two policy recommendation for our government here or other government whom they have the same scenario of Black and minority ethnics, what they should do, and then we can finish this on time. We only got 2 minutes, Shadia, or 3 minutes.
So first of all, I always say education comes first. Education, education, education. We have so many schools underfunded, particularly in BME heavily occupied areas. So we need to fund the schools. We need to give students all equal opportunity to pursue education and higher education and compete for good jobs. This will bring the BME population to the competition life for jobs and good lifestyle. We also the government also have to review their policy about social housing benefits, such as the universal credit. They have to review those policies and take BME in consideration, not just because of color or anything, because of the other factors I mentioned in my presentation. So what they say is, you can be fair, but to be, I think, equal. If I translated that right, you have to give everyone equal chance to come to the start line if you are going to conduct a race. So, like, if we can say white population are already at the race line, we are 10 years behind. They have to bring us. So actually, our lives matter until we are equal, and then all lives, of course, matter. So they need to look at the education. They need to review their policies of benefits and housing or social housing. And we need to, I think they have to look at employment opportunities as well for BME ethnic minorities.
Okay, Dr. Shadia Omar, thank you very much.
بنحلم بفضاء أوسع، بنحلم بزمن أجمل، بلاد ميلاد، بلاد ميلاد.